I'm one of the distributors of Jigsimur, and I've had the opportunity to meet a lot of clients who complained of having fibroid, and some of them, they find it difficult to believe that Jigsimur cures fibroid, even when you're trying to convince them. Please, does Jigsimur cure fibroid, and how is a fibroid patient meant to take it?
Well, body differs and body react to treatment in different forms. Jigsimur cures fibroids. You have to understand the fact that fibroid is a growth. Fibroid is also a parasite that lives in the body of the host. Fibroid feeds on you. A Jigsimur has the ability to detach, to disengage fibroid from the host. Because as a matter of fact, we are actually feeding the fibroid by virtue of what we eat. But the use of Jigsimur will help you to detach fibroid or to eliminate fibroid, to stop the growth of fibroid. Of course, virtually almost all every woman have fibroid, and so we feed the fibroid over a time because of what we eat. But because of the 100% alkalinity of the aloe ferox in Jigsimur, is able to stop the growth of fibroid and also treat fibroid. We have had cases where we have used Jigsimur to treat different sizes and types of fibroid, and it's giving us tremendous results.
Okay, thank you. So how can a fibroid patient take Jigsimur, and how many bottles do you think the person needs to start with?
Very interesting. I can't tell you can take one bottle. I won't tell you take two bottles. Like I said, body differs. There's somebody that has taken two bottles of Jigsimur and the fibroid, jumped out of the person. There are people who have taken over 5 bottles, which is our treatment pack, and depending on the size of the fibroid, depending on how long it stays there. You mean you can't go to the doctor and tell the doctor how many injections will I take to be well. The same thing is applicable to Jigsimur. If you are a fibroid patient, for instance, I will advise that you start your treatment first and foremost about what I call the water fasting. Because if you reduce the quantity of carbohydrate and the quantity of sugar that comes into the body, the fibroid will have little or nothing to feed on, and so it begins to die down. So if you're a fibroid patient, I will advise that for 3 days, please don't go on carbohydrates. Go on fruits, go on vegetables for 3 days. After which you take a lot of water. You must take a lot of water in the daytime and less water at night. The reason for this is for us to be able to starve the fibroids, not to feed from the host for 3 days. Thereafter, you can start taking your Jigsimur, 15 ml daily, 15 ml morning, and 15 ml night. Gradually, depending on how fast your body can respond to treatment. But one thing I am sure is that it will surely treat the fibroid because it has always treated fibroids.
Thank you very much.